Hello everyone, this is Team Glitch and our project title is Healthcare with Distributed Laser Technology Solution. Our team Glitch is formed with three members. Myself, MD Ariful Islam, MD Antonin Islam and MD Amjad Hossain Jackie. Our mission is to digitalize the healthcare service and its administration process in national level so that every data can be preserved with well documentation so that we can establish a fair and strict monitoring on corruption in these sectors with all this live documented data, and also to develop a great customer relationship management system which can remove the communication gap among the authority and customers. Vision. As our system is preserving all this medical data in a well-formation and structured way, our mission is to convert our healthcare system into a kind of free, whose each node will collaborate with science and engineering in order to open a path for the future. We are aiming for a day where we can see healthcare in a technically self-sufficient position, which will provide the general people with fast and automated medical service. Problem statement. To ensure the healthcare services, there is a dedicated ministry in Bangladesh. So as the ministry is operating in national scale, there is a huge budget maintenance and its official flow of documentation runs on its every working day. But as the ministry is running in national scale and deals with a huge population, it is accused with some allegations. For the lack of proper and fair management, documentation and records can be manipulated and allegations will take place. As the ministry operates in a national scale, a massive communication gap occurs among the authority and consumers. Anyone can take advantage of these limitations, and any officials related with this service can raise their value of qualification by using fake documents. In Bangladesh, our national level healthcare service is still operating with paper-based documentation. These hard copy documents also need to be stored for the official formalities. But as the ministry serves almost 163 million people across the country, the population of storing all these hard copy documents cannot be served properly. Due to lack of monitoring, some official personnel are taking advantage of it. As an example, the rural people sometimes faces lack of doctors in their areas, and some government doctors can be found practicing in the private chambers. In Bangladesh, we can see a common scenario that some doctors are forced or influenced to prescribe medicine which are distributed by private distributors. Every year, a lot of news can be found in our national dailies which claim the evidence of corruption in national healthcare. Government-free medicines are getting sold in most common scenarios among those. Though the People's Republic of Bangladesh try to improve their service and prevent corruption according to the feedback of the general people of the country, but the ministry is so big and deals with a huge population, the higher authority cannot get proper feedback from the citizen. And the current process causes much hassle for a common man. So people just avoid the complaining process to the authority whom it may concern and criticize the system on social media platform. Followed by this problem, we have a proposed solution which can arrange all this documentation in a digital form with a well-structured process. So each data can be neutral for a fair monitoring. From the preserved medical data, every citizen and appointed doctor can check his or her current and past medical records and easily judge the patient's health status. Previously taken medicine history can be also checked for avoiding any side effects. Prescription. This can be an ideal document where all other digital medical features merge together. Here, every patient will be documented with proof that he or she was served by a duty doctor in a particular date and time. Patient get his or her medical document from this online portal whenever he or she need it. In the appointment segment, patient can place an appointment remotely. This system will store the duty doctor's working hours and educational qualification. This system can simplify the searching process of a doctor according to the patient's disease and nearest location, so that the sick patient can easily place an appointment without any difficulties. Most importantly, the complaint segment. Here, if any citizen is not pleased with the services, he or she can just place a complaint. Patient's documented medical record with its date and time can be used as an evidence for investigation and taking action. With online portal, citizen can also track the complaint status. In case of the stakeholders, we will be describing our solution with three organizations, where each will be represent its user to uniquely identify and access to our private DLT service, such as ORG1, which will deal with all the healthcare officials. ORG2 will deal with authorized doctors, and ORG3 will deal with citizens. This base can be easily adopted and scaled by the government of Bangladesh, as they have already dedicated ministry and organizations for it, for the authorization of the doctors to medicines and diseases research. Each of those are already operating nationally. Even Bangladesh Election Commission already uniquely identified every citizen under the national ID card wing. In the system architecture, the whole operational process is visible. It can control the user registration, drug or medicine authorization, and maintenance of medical history. In all this process, there will be only one physical interaction among doctors and patient. The rest of the full operational process will happen remotely. For different types of user will have individual interaction point which will cooperate with the blockchain. As our proposed solution based on private DLT, it has a strict governance process from the starting of its development and during its every functional step. First, there will be a dedicated certificate authority server for the orderer itself and every organization individually. These servers will certify the node for existing in our DLT network through MSP or membership service provider. Each organization will hold an admin of its own. For the frequent response, only the organizations will hold a world state. Here, each of these nodes can have multiple peers, but the organization's starting peer will be known as anchor peer, and other will be gossiping peer. The peers of the orderer will be for consensus mechanism. In the organization, each admin will be responsible for enrolling the user with MSP who can access our private DLT as an actor. Data flow. First, the doctor installs the software. Next, the software requests for credentials such as username and password. After the doctor enters his or her credentials, the software requests for validation to client SDK. The client SDK next requests for world state information to endorser peer. If the request is valid, then it sends the world state information to client SDK. Otherwise, it doesn't send the world state information. Next, the client SDK matches the credentials and sends it back to the desktop software. Finally, if it matches, then it displays login successfully. Otherwise, it displays invalid credentials. After being successfully logged in, now the doctor can perform its operations. For example, doctor will now request an add prescription operation. So first, the proposal will send to client SDK, who will forward the proposal to endorser peer for sign with the digital signature. Then if the request is valid, then it will send the signed proposal back to the client SDK. After that, the client SDK will send the signed proposal to orderer for ordering. Now the orderer will run consensus mechanism. In our case, we will use Raft. Then it will send the committing peer in the orderer to commit into the ledger. After it has been committed, the peer will get notified that the ledger is updated. Finally, doctor will see successful message on their display. In the technical architecture, the user interaction point will be developed with Express.js and will run on Node.js. That will act like a regular three-tier application. This application will be connected with private blockchain service. For national level service, it is well known for its privacy, security, and transparency control among the trustable users. To make sure all the standards of private blockchain, we will establish our proof of concept on Hyperledger Fabric, which is introduced by Linux Foundation itself. Most importantly, in the orderer, we will be using Raft algorithm as consensus mechanism, because as our network will have multiple orderer nodes, if any of those fall down, other will become the new candidate, and with proper approval from other orderers, it will verify the new block for the blockchain. Finally, each of our organization will have a dedicated CouchDB which can respond fast on a frequent request. In the network architecture, we can see how our client application communicates with the DLT environment. We can see that each of the node holds a block and ledger. The organization also holds the chain code. That is why it is called distributed ledger technology. Now we would like to demonstrate that why our blockchain-based solution is immutable. At the very beginning, there will be a genesis block. After that, we can see that 3 prescription has been created with the system. So after passing all the endorsing and governance process, a new block will be created. For that, the current block's hash will be taken and it will be added with the hash of newly added data. The value will be merged with the new block number and new block's header will be created. The new block will be also created successfully. For the next new block, the process will be same. So from here, it can be seen that every block is actually related with the chain of sequence as a blockchain. So from the middle, any information cannot be manipulated. That is why blockchain is defined as an immutable ledger. We can explain the valuation process with SWOT analysis. Here, the strength of our project is its inventory of digital medical data, which can be kept and maintained by the National Data Center. These data can be considered as an asset which can unlock many opportunities for the industrial growth and also the future of National Blockchain Cloud Service Program. The only weakness of this project is that it is an undergrad level student project. There is a threat of user identity theft. User awareness must be developed after deploying this project. In the conclusion, we want to say that this DLT solution can unlock a great opportunity which can introduce the people of Bangladesh with the healthcare service of the first world country and establish the base of data science and automation, etc. for the fourth industrial revolution, so that the philosophy of digital Bangladesh can take shape in reality. Thank you.